Well, when cats get UTIs or urinary tract infections, which happens quite commonly, and sometimes it can be the way their diet is or the way they process their food, and they can make crystals, and those can be in the urine, and those can irritate the bladder. There's a school of thought now that maybe they get a urinary tract infection and the crystals come secondary, but anywho. So with that, if they're in the litter box a lot and they don't pee a lot and they're in there a lot, they may in fact have a urinary tract infection. And then what you do is you go to the vet and try to do a urinalysis, and that'll see if there's red blood cells or white blood cells and or crystals in the urine. And if that's the case, antibiotics typically do it, and some anti-inflammatories. When male cats get a urinary tract infection, that can be life-threatening, and what can happen with that is they the crud and the debris that happens with the white blood cells and the blood and all that can actually go through the penis, but then the urethra is pretty narrow, so they can actually block, not be able to pee, and then their bladder just can get really distended. It's super painful and it's potentially deadly. So anytime they're in that box more than they ought to be, and they seem to be painful, even peeing where they shouldn't, because they may be avoiding the litter box because they associate that with pain, that would be something that really that needs attention. Well, when your dog and your cat's breath stinks, usually most of the time what that means is their teeth are dirty. And if you go years without brushing them, that's probably the case. So it's really a challenge for folks to brush teeth. If you were to do that a couple times a week, that is a pretty awesome thing to do. But most likely just from the tartar and plaque buildup, and then the gingivitis that happens with that, certainly leads to periodontal disease, and with that, that's by definition, and it's inflammation and infection, and with that becomes all that terrible odor, and they can become systemically ill with that. Now all that stuff's absorbed through the mucous membrane of the gum, and then that can really just make them sick. Not to mention their gums and their bone around their teeth can actually resorb, just basically deteriorate away, and they get tooth loss and all that, which can be painful in itself. So there can be other things like mouth tumors, or there's this one condition called stomatitis, which is a really bad inflammation of the tongue and mouth and the gums and all that, and those can be autoimmune kind of things. But if that can be a good indication of just general health, and if that happens, that needs to be checked out. So with anxiety in dogs and cats, we see a lot of that, and I don't know if we're just more in tune to it, but everything from sometimes aggression or inner dog stuff, or cat, you bring another cat in, or you have a number of cats, the anxiety can come up. A new cat in the neighborhood that would be peeing on the bushes out can just cause a lot of anxiety to the cats inside. Separation anxiety, where more so dogs are really bonded with their owners, and they're gone for 2 minutes to all day, can really make the anxiety, and they can be destructive and all that. So with that, there's a few things with that. You can sort of hyposensitize them a little. Dogs especially will pick up cues. If you pick up your car keys or put on your hat, those kinds of things. Cats will know if you're bringing the carrier out, those kinds of things. If you can do that and then not proceed with leaving, say, it might desensitize. There are all kinds of really cool things. There's a couple hormonal things. Feel Away for cats, Adaptil collars. Those are pheromones, which are hormones that make you feel safe when you're around those. And so what's cool with that, it lowers anxieties. There's things like thunder shirts, which are I really like. They've been studied, with I think University of Florida had done a pretty cool study with them, and they just feel swaddled as a baby. They go around them, and there's this extra piece of fabric that kind of velcros, and they just feel swaddled, so they feel more secure. And then there's medicine, and with that, Prozac or other anti-anxiety medicines, typically they don't have any bad side effects, and most of the time they're pretty effective. And so we just see a lot of that. And if you guys notice that would be there's a few things that may help manage that. When I was in vet school, they had it set up where we could handle horses and livestock to get some large animal experience. And I came from the farm background, so I felt like I was pretty good shape with that. But a lot of the classmates, most of them were not from a farm background, and a lot of them were from New York City or Philadelphia or Atlanta, and they had not had any kind of large animal experience. So one of the things that they blessed us with was we had to bring horses in, and every morning had to bring them into the barn, and then every evening we had to take them back out to the paddocks, and this was on a rotation kind of thing. Well, they had this really, I guess, a small horse or a big pony named Shorty, who was a stallion, and he wasn't that big, but he was very muscular, and he was mean. And we were asked to bring that horse up, and then take him back. And with me having some, been around horses and all that, you would fight him the entire way, and he would try to grab a hold of you, and you had to handle him and at least show him who was boss, because he was used to the greenhorn, so to speak, grabbing him, and then the next thing you know, they were kind of getting abused pretty bad. So these city kids, it was awful, but it was good at the same time. They soon learned really quickly how to not let this horse bully them to the point of getting his way. But it was a long haul from the barn to the paddock both ways. So that was a pretty good education right there. So.